Hello, have you ever wondered how to use a package insert? Well, here's your opportunity to find out. Today I'm going to give you a brief overview of the important components of a package insert to help you find the information you need for this class. The first thing you need to know is where to find a package insert. Package inserts are usually attached to the prescription bottle in the pharmacy and is an excellent source for the pharmacist. Here's an example of a metformin package insert. As you can see, the print is very small and it could be difficult to find the information that you need. However, since many of you do not work in a pharmacy, the easiest way to access a package insert is online. It's available in PDF form from the manufacturer or from the FDA. Let's discuss some of the important components to look for in a package insert. Most package inserts begin with a description of the drug. It gives the generic and brand names as well as the class of the medications. It also includes a diagram of the chemical structure of the drug for all the chemistry nerds out there. Then it gives the clinical pharmacology information, which is where the bulk of the information will come from for this class. One of the things you want to look for is the mechanism of action. It tells you how the drug exerts its therapeutic effect. Then comes the pharmacokinetics, which is a very important component of the package insert. This talks about the absorption, distribution, metabolism, and excretion of a drug. And these describe what the body does to the drug as it goes through the different systems. Up next is special populations. This gives us guidance on how the drug can affect different kinds of patients. It often addresses medication use in children, different races, pregnancy, elderly, and patients with renal and hepatic impairment. Renal and hepatic impairment are extremely important to look at because they help to determine what dose a patient should receive and can prevent life-threatening side effects from happening, such as severe hypoglycemia. Next is indication and usage. This tells us the FDA-approved indication for the medication and also describes its place in therapy. Contraindications tell us which patients should not take this medication. For instance, metformin is contraindicated in patients with severe renal impairment, and it should not be initiated in these patients. Warnings and precautions also provide additional details about severe side effects or interactions that can occur with the use of a drug. It also offers guidance on how to prevent or treat them. We will not cover information for patients in this lecture, as these are a summary of important drug facts in layman's terms that are geared toward the patient. However, it is important to look at adverse drug reactions to identify which side effects are most likely to occur with the drug. Up next is dosage and administration. Dosage and administration are important to prescribers. It tells them at which dose a drug should be initiated, the dosing frequency, and the route of administration. It also tells you the maximum daily dose that can be given. Finally, you may want to know how a drug is supplied. Is it a tablet, an injection, or a powder? All this information can be found under How Supplied. Just to recap, a package insert is an excellent source of drug information for pharmacists, prescribers, and educators. It is available on the medication bottle or online from the manufacturer or the FDA. and it provides a description of the drug and discusses its clinical pharmacology. This concludes our review of how to use a package insert. I hope it clarifies things for you. Until next time, have a good one.